Hello, my name is Rebecca Seagraves, and I am joined by the one and only Dr. LaShonda Jones. I'm absolutely thrilled to be speaking to the primary author of the Cesarean Delivery Rehab Protocol. And Dr. Jones, I want to get right into this. What was your aha moment that cesarean delivery really needed more attention from rehab professionals? What was your aha moment?
My aha moment was being the cesarean mom. Basically having my own C-section, unplanned. Yeah, that was my aha moment. So basically going into my own birth thinking I was going to have a vaginal birth, unmedicated birth. That was my plan. The doctors had checked me for, my baby is the right way, all of these things. And so that was my expectation. And then I had an unplanned C-section and I was hella unprepared, Rebecca. That's what I was. And so, in reference to knowing what I needed to do, recovery, anyone telling me what type of, incision I had, staples, glues, I knew none of those things in regards to mobility. I mean, from a PT standpoint, right? Mobility, yes, but all the specifics that I thought I would have gotten because now I've had this cesarean section, okay, there's some type of different follow-up they're going to tell me. And then there was nothing. And so from a PT standpoint, I was shocked, but honestly, I was in the thick of it myself. And I was just a mom trying to recover, just like every other mom out there, right? Just trying to adjust to my new baby, trying to adjust to this new baby in the home. Should I do the stairs or not? And it wasn't until my husband asked me, should you go up the stairs? And I was like, I don't know. And for me, that was the, whoa, wait, nobody told me anything, right? And it wasn't until he asked me that question that I realized that, you know what? If I am not being told these things as a physical therapist, but I at least have the knowledge that I do as a PT, what are the other moms that are out there who have no knowledge of what they should feel, what they should see, how, I was messaging other C-section moms and asking them, hey, when does this numbness go away? I wasn't prepared. I simply was not prepared. And at that time I was purely ortho. I wasn't in the pelvic PT world. So I didn't know these things, honestly, because in PT school, we're not taught these things. And so I was like, you know what? This is crazy. And so talking to other moms, talking to other PTs even. I was like, is this normal? And once I realized, oh, this is the norm. I was like, oh no, we have to change this. So yeah, I started inch by inch, resource by resource, research, just to basically get to this point. So yeah.
We crossed paths about sometime last year, and correct
Hmm.
me if I'm wrong, because
Hmm.
I was very new to social media. My first account opened in 2021.
Hmm.
And so I
Hmm.
didn't realize that other therapists were also searching for these answers, but you
Hmm.
had a whole program around supporting moms after C-section
Yeah.
before I even heard of that there was this thing like this.
Yeah. And
Right.
so I was looking for that. I was looking for that resource because, again, I was the mom, right? I wasn't into pelvic health or anything like that. So I started researching, a C-section recovery guide or something like that. I may have seen maybe like one. And I was shocked, honestly. I was just like, oh my God, like, are you serious? Like, not even from a physical therapist standpoint, there's not even physical therapists that made these things. It was very interesting to me. It was a couple of PTs that I saw talking about it at the time. Mind you, I had my daughter 7 years ago, so it's been some time. So a lot has changed since then, of course, but at that time, even social media was still, more people talking about more serious things on social media, not just puppy dogs and flowers. But at the same time, it still just wasn't a lot out there. So yeah,
Yeah.
I created my own guide, just started doing research, going a lot by my own experience, and then what research I could find that was out there in regards to more so wound healing times than actual C-section recovery, right? Because still to this day we lack a lot of research around C-section recovery, but it is improving. So that's a good thing. But at the time, there wasn't much. So I had to go off of what I had and, just again, hoping to improve it more and more.
And more research actually has been done on abdominal surgery in general. Like, we
Hmm.
actually had to, when we were starting programs in the hospital, to offer moms occupational or physical therapy, we were going off of guidelines around hernia repair,
Hmm. Right, right.
right? But
Yeah,
that's a, respectively so. I mean, it's a much smaller
yeah.
surgery. It's not at, I mean, there are some open abdominal hernia repairs,
Hmm.
but
Hmm.
nothing to the extent of the length and the depth of a C-section,
Correct, correct.
right?
Yeah. And then, well, and then, depending on when these women get, because you can get a hernia repair without any birth being involved, but a lot of moms, postpartum moms, do end up having hernia repairs, but typically not at the same time as giving birth, right? And so that's the vast difference between the two, is that these moms are basically giving birth and also having major abdominal surgery. So you're going home with a newborn and with a carrier, with strollers, all of these things. And so if there's no guidelines other than don't lift anything above 10 pounds,
Yeah.
that's just not enough. It's not enough. And so moms, they're just trying to survive. They're just going off what they know, whether you told them to do stairs or not. Again, where do I see moms asking these questions is in social media pages. And sometimes, a lot of times, there's misinformation there, a lot of opinions, but not an actual standard of rehab protocol care. So, yeah, we have
So
to
if there
create.
was something like you wanted every mom to know, even right from the hospital, so from your own standpoint, your husband was asking you, "Can you go upstairs?"
Mm,
And you were also thinking of, okay, so what can I do? What can't I do?
mm.
What specifically do you think that moms should and could be told right from the hospital bed?
Oh, for sure. So, like, what I educate moms on is just simply breathing,
Mhm.
right? That's
Right.
something that we do every single day, but we're not taught how to do it correctly. So, like simple diaphragmatic breathing, just reconnecting with their core, their pelvic floor, simple mobility movements that they can do from the hospital bed, just getting up, mobility, walking. Right. And so I
Mhm.
think a lot of people do tell moms to walk. I think a lot of them at least get that minimal information, get up and walk, get up and walk, but also restorative posture things that they can do to help restore their posture. Because again, that scar tissue is laying down day from the beginning, the very beginning. And so we can't wait for 6 weeks to begin any type of scar mobility. No direct scar massage, right? But you can improve the mobility and how that scar tissue is laying down just by simply diaphragmatic breathing, doing belly breathing. That's indirect scar mobility. And so those are things that moms can be doing from the very beginning that can really help with their recovery in the long run. And so those would be the things that I would just say, again, educating themselves as much as possible, preparing themselves as much as possible. Those things are even before they even reach that point. But again, once they actually have the cesarean, get up, get it moving, um, making sure that you are doing some type of indirect scar mobility, those type of things. Those things can be really, really helpful.
I remember the first time I walked in to a mom's room, and she had also had an unplanned C-section, and her partner
Mm-hmm.
was pulling her up from the bed by her arms.
Mm-hmm.
And I immediately was just like, okay, that's the first thing we have to address, right?
Right.
Because I mean, because that pulling force through the abdomen, especially
Mm-hmm.
after a C-section and open abdominal surgery,
Yeah.
I could see her face. She was wincing in pain. And I
Mm-hmm.
was just thinking, there's such a lost opportunity in just teaching people the basics.
Yeah. Exactly. Bed mobility, getting up and out of the bed, whether they have a high bed at home, using a stool, having those things, ready. And I say also to this because sometimes we put a lot of emphasis on teaching C-section moms. So I think every mom should know these things, right?
Mhm.
Because birth is very unpredictable. And so that was my mistake, hindsight, was that I didn't prepare myself for the unpredictability. I mean, I knew, okay, there's a chance, but I didn't prepare myself. I didn't have things in place at home in case this happens. And so I tell moms, learning the basics of bed mobility and things like that. No, you may not feel like you need that even from a vaginal birth standpoint, but yes, that's still intra-abdominal pressure going through your core, all these lax muscles, all these lax tissues. And so, of course, it's even more so when those tissues have been cut. But learning the basics of bed mobility, teaching, partners, we teach partners how to do Lamaze, but we're not teaching partners how to help their spouses, and so there's so many opportunities for learning moments, not just for the mom, but for their supporting spouses or caretakers or things like that.
So moms will usually say to me, "Well, why doesn't my surgeon know about this?"
Mhm.
And most patients will even say that, from a standpoint of like knee replacement, like we're not really necessarily going out to people directly and talking about the rehab after knee replacement. That's really kind of funneled through when they choose to have the surgery, then their surgeon, or at least that office, connects them to all these resources.
Yeah,
And our paths cross because you were like, well, how can I get how can I get these guidelines into the hands of surgeons?
yeah,
And so what would you, if a surgeon was tuning in right now and they're, orthopedic surgeons, so to me it's like a no-brainer. They know how important rehab is, even same day of surgery after shoulder replacement. We've seen patients same day after hip replacement in the hospital. But OBGYNs, to me, they're no different. What would
mm,
you want them to know that other surgeons seem to just get automatically?
mhm. That standard of recovery care, that number one, it can be established, right? And that's what we're doing with the protocol. That's what we're basically working to establish, is that standard of care, because that's exactly what orthopedic surgeons and everyone else has done, is that they saw that need there. And so it has to be a highlighted importance of that recovery, how it can help with the reduction in moms coming back from, scar or incision infections, or moms coming back in hospitals being charged so much money because moms are having to come back because they opened their incision. So the basics of understanding, like, wow, just getting pelvic PTs into the hospital, getting pelvic PTs, or getting, even in home health or whatever the case may be, at some point, that's going to help our patients, their patients, basically heal better, heal faster, and have a better recovery. And so the reason why surgeons put those things in place, because they want their surgical outcomes to be good. They want their patients to be good. And so having that same mindset, even from an OBGYN standpoint, if we can work together to establish that, then that's going to help so many moms. And it's going to also help them in the hospitals on so many different levels, because then we're working as a team to help them establish that better standard of care.
I might have shared this with you, Dr. Jones, but I was at our conference, CSM, as
Mm-hmm,
part of the American Physical Therapy Association, where
mm-hmm,
Duke University Health System presented their preliminary data, and they brought pelvic health physical therapists into the hospital on the maternity unit
mm-hmm,
and in telehealth.
mm-hmm,
And they were working with moms within a day or two after C-section, and they found that they saved the hospital over an 18-month trial period. They were just doing a pilot program.
mm-hmm.
They saved their hospital system over $500,000. When I heard that, I said, "Oh my gosh, did we need a protocol more than ever now to set
Oh,
a
yeah.
standard of care in every hospital?" Because C-section is the most common major surgery performed in the world, but the most common surgery performed in the United States. So, for any mom that's listening, what is the cesarean delivery rehab protocol? How can she either bring it to her OBGYN? Should
Yeah,
she have an unplanned C-section at the time of her delivery? Like, what exactly is it? Can you break it down just so like the lay person can understand it?
absolutely. Can I show it?
Oh, yes. Oh, yes. You actually have a physical
We
copy, so
have a
even
physical
better.
copy.
Yes.
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 And give yourselves props to Dr. Seagraves, my partner in crime, in creating this.
It looks
But
so
yeah,
beautiful. Can you just put that up again? Like, this is not, I am not sharing the screen or anything. This is a physical copy and it
yeah.
goes week by week. So that's week one. And it goes up to what? How many weeks,
We're
Dr.
doing all
Jones?
the way up to 21 plus weeks. Yeah.
21 plus weeks. So, yes. Okay. Let's break it down.
Absolutely. So we're speaking to the mom who is having the
Yes.
C-section, how they can get this in the hand. So
Yeah.
for my
Or just
reference,
just preparing for a birth, because who knows what your birth outcome is going to be.
absolutely. So, but in reference to them getting the protocol, right, is it what they should know about? Or
Yes.
yeah.
Yes.
So essentially, we created this protocol for, not just for the PTs and the therapists, but if we have a mom who is like, you know what, I want the standard care that they're speaking of. Like, I want better for myself, and I want to be able to move better. I want to be able to heal faster. Like, these are the things that I want. this protocol that we've created, that's exactly what that is for. And so what this protocol does is it lays it out week by week. We put in their mobility, what things like when they can start doing what they should be feeling, what they should be seeing, when they should be massaging their scar, when they should be doing pain management. Like all of those things are in the protocol. Everything from, I'm going to kind of go through it as we're going through it here, but like abdominal protection, like bracing your core with a pillow so that you can help reduce that pain. So many moms like it feels like death when I sneeze. So just something simple as how long you should use that abdominal bracing in the pillow. In those first 6 weeks, super important of doing that again because that incision is healing. So we went over incision care in reference to reducing pain, reducing swelling, how long that you should be using ice, how long when you can begin using scar tape, when you can improve the appearance of your scar, like all of those things are there. And so having that standard, they can take that to their doctor, to their OBGYN, and they will be more informed of what are some of the things that they can be doing in the hospital. What are some of the things that they can be, again, doing in their home? And then from a either doula or support person, them being there with you, especially if you have like a postpartum doula, they too can also help you using this protocol to know what it is that you should be doing, what you should be feeling, and when it's safe to do. Because a lot of moms have a lot of questions. And so this brings that standard for them to be able to say, research-based, evidence-based, wound healing time-based, this is what I can do and do safely so that I can reduce risk of injury, reduce risk of injuring my incision, all of those types of things. And so we have this protocol available completely free to whoever will be able to utilize it and to be able to help them start moving better, heal faster so that they can get back to exercise, get back to life, being able to pick up their kids, all of the things, because, C-sections don't just affect your tummy, it affects the whole entire person. And so we want to be able to get you back and also reduce risk of hospitalization due to high blood pressure and things like that. There's monitoring of vital signs in the protocol. It's pretty much everything you need from birth to 1+ year postpartum, what to do, when to do it. And so I think that is very invaluable because, again, this information didn't exist when I had my C-section. So the fact that something like this can be so helpful to so many moms, we want to get it into the hands, hospitals of whoever it can help.
Absolutely. And we have a surgeon who's on the protocol.
Mhm.
She was honestly one of the biggest champions of physical therapy that I've ever met. She had an automatic order set in her hospital, Dr. Karen Fox, for physical therapy after really those complicated C-sections,
Mhm.
Dr. Jones.
Yep.
And even Duke said this in their preliminary data is that the patients that did come back to the hospital during their 18-month pilot program were those
Mhm.
moms that included, women who had suffered hemorrhage, uncontrollable blood loss
Yep.
after their C-section. And it was just, unfortunately, just not controlled. And it's those things that I think in this protocol that really guide moms on the type of movement, the type of frequency, things that would help their uterus heal rather than, unfortunately, in those cases, break open that incision on the inside that would cause that uncontrolled bleeding. That is just not being given as a standard of care. You will go into a hospital, have a major abdominal surgery to have your baby, and not be offered rehab versus someone who has a hernia repair. And I've seen many patients in the hospital after a hernia repair, and they're given rehab almost every day that they're in the hospital. And so the discrepancy between care to me is like we can't unsee it. But
Yep.
what I want to leave the audience with one more thing is that we have this protocol. It's in the language to a health professional. It's not in the language that's very friendly for a mom to just follow on her own if she wanted to.
Mhm.
So you already had a plan for that. I mean, I'm talking about when I met you, Dr. Jones, you literally had thought about almost every perspective of cesarean recovery in a way that I've not met a therapist think of, right? And so as a doctor of physical therapy, you had your own experience, your own perspective. You were thinking of the mom's perspective, and then you also thought of this provider perspective and creating this protocol for surgeons and health providers. But what is that resource that you have for moms who don't have that support team? What's that one resource that you really want moms to know about, and that they can't access right now?
Right. So I created a cesarean recovery and safe return to exercise guide. And so that is made for the mom. It goes, very much checklist. I provide checklists in reference to what to ask your physician, even before you have the cesarean. This is, for moms who have a planned C-section. So things they can ask their doctor, things that they can, a whole entire must have recovery list in regards to recovery products that you want to have in your home, things you want to have at bedside so that, when you're doing your log rolling, the baby's there. So much as the co-sleeper. So basically a whole entire list to help them with through recovery, and then step by step, week by week, what exercises they can begin doing even in the early phases. When they can begin doing is broken down week to week, and it's very detailed. So I created that cesarean guide and included exercises, scar massage, how to do scar tape, pretty much every question that I could find out there on social media. I made sure it was in the guide. And I explained it in a way that moms could understand. And so also when to see a pelvic floor PT, right? So what signs and symptoms of there's a need for additional care outside of just what you can do on your own at home, because you want to be empowered and know how to do your own scar massage, but not every mom is ready for that. Not every mom is mentally or emotionally ready to touch their own scar. So understanding that you can see a pelvic floor PT, what things or what are signs that you need to see them outside of just your scar, because a lot of moms don't understand that they can also have pelvic floor issues, even though they had an abdominal birth. So a lot of education around that, when you should see a PT, what exercises you can do. And so it's very laid out. It's about 65 pages, but don't let that overwhelm you. It's broken down, and you basically go in and you use it based off of where you are. You use it whether you're newly postpartum or I'm just seeing this today and I'm 3 months postpartum. You go right in and you do whatever it is that you need to do in reference to strengthening your core, getting back to exercise, how to return safely to running, swimming, whatever the case may be. It's all inside of the guide. And for my moms who are more like looking for just exercise space, I created also a post-abdominal surgery program as well. And it's 8 weeks. I was about to say 6 weeks. It's an 8-week program, and it's full of just videos and exercises they can do, showing you how to do diaphragmatic breathing, showing you how to restore your posture, restore your mobility. So everything that's basically inside of this guide, inside of this protocol, is in one of my resources. So I created both of those for the cesarean guide specifically for C-sections, but the post-abdominal surgery is for any type of surgery. So hernia, basically any type of major abdominal surgery. I created that. Hysterectomy, post-hysterectomy, tummy tuck, diastasis repair, anything. So all of those exercises are for them as well.
Okay, amazing. I was gonna go down the list because I'm like, wait, any surgery that's affecting the abdominal
Mhm.
muscles. Okay. Where can people find these resources?
Mhm. So you can
Yeah.
Yeah, you can find me on social media, primarily on Instagram at PT Trainer Shonda. We'll make sure that you get the link to that. But then you can also check the link in my bio. All of those resources there. I have tons of free resources as well. That must have C-section recovery guide. C-section recovery list that has the list of all of the products. That's completely free. I have a e-guide as well that has 7 exercises that you can do post abdominal surgery. That's completely free, as well as my resources of the programs. All of those things can be found in the link in my bio as well. And this protocol will be there very soon as well.
I was gonna say,
So
and
we'll
this
put that up
protocol
soon.
is what you would actually take to your surgeon or take to your health provider or take so that you're advocating,
Yes.
insurance is gonna cover your surgery. We know that, right? Insurance is gonna cover those procedures around your surgery, and it absolutely will recover your recovery. And so if you are wanting a rehab therapist in the hospital or maybe someone coming to your home or whatever, you have now a protocol that those professionals can use and justify care for you, right? You don't have to do this alone. But if you don't have that robust support, you also have a recovery guide that Dr. Jones has created. This is phenomenal. Just to close, is there anything that you want really other professionals to know? Because I'm already thinking, well, doulas, every doula, every midwife, every OBGYN, of course, all of these professionals should know about these resources so that they're instructing moms earlier. But is there anything else you want to say to other professionals who might be timid to provide recovery care to this degree to moms after this major surgery, after C-section? Is there anything else you want them to take away from this message?
Mainly that is, it's a team approach, right? And so for me, creating that guide, I reached out to OBGYNs, I reached out to doulas, I reached out to everyone because that's the reality is that it takes a village to help moms heal and recover. And so if they're in a space where they don't feel comfortable with a specific thing, refer, right? And so that's from where there's an OBGYN, there's so many amazing pelvic PTs that can help moms recover. There's so many amazing doulas that can support moms at home if they don't have the support and the partner there. And so when we work together, that's how we create the change that we want to see, number one, but we also provide moms with the care that they need in that very moment. And so, yeah, utilize this protocol. That's why we made it free. Reach out to us as a resource. We're happy to be a resource and also to be a referral to them as well, because again, it works both ways. And so if there's anyone that have any questions, I'm happy to be a resource. Please do DM me. Please do email me, and I'll be happy to help how I can.
Dr. LaShonda Jones, thank you so much. Thank you so
Thank
much for your
you, Dr.
time, your
Smith.
passion around this subject, and just our communities really that are being served the most by this.
Thank you.
Thank you.